Currently, as of March 16, 2017, there have been 53 cases identified of Candida auris in the United States, and a majority of those have been bloodstream infections, and have occurred in the majority of them are in New York and New Jersey area, but we also have cases in Illinois, Maryland, and Massachusetts as well, and so we are very closely working with those health departments to track those cases and make sure that containment efforts are in place for those cases. And what I can say about those cases is that they are generally very sick people who get Candida auris, like people who already have a number of underlying conditions and have extensive exposure to healthcare facilities. So a lot of these patients had been hospitalized in more than 3 facilities in the 90 days prior to when they developed Candida auris infection. The other feature about them is that these patients have had extensive antibacterial exposure as well as antifungal exposure. So, these are not this is not an average person who gets this infection. It's really already very sick people who have been in healthcare facilities for a long time. Our patients have ranged from somewhere in their 20s to 80s. We have not seen any pediatric cases in the United States, but we have had reports of pediatric cases, especially from South America. It doesn't mean that it can't occur in pediatric cases in the US, but fortunately, we haven't seen it so far.